Hi, thank you everyone for joining us today. I think there's a couple more people logging on, but we'll start off with some introductions. So I want to welcome everyone on behalf of ACRO and our resident committee to come join us on this webinar talking about, the radiation oncology ERAS interview and matching process. My name is Leslie. I'm currently a PGY4 in radiation oncology at Johns Hopkins. And I'm here with Cecile, who's a radiation oncology resident at UCLA, and we'll be your moderators for this talk today. And before we begin, we just want to have a quick plug for the ACRO Resident Committee. If you don't already, please follow us on Instagram and Twitter. We have a lot of free membership resources for medical students and residents, grants, scholarships, educational resources. So if you haven't already, please do look for us there. And please do register to be a member of ACRO as a student. It's completely free, and there's a lot of resources, much like this one, that can definitely help you. In whatever you're interested in radiation oncology. And an overview of just the webinar today. So we're having presentations by 3 different program directors in radiation oncology, and they'll talk a little bit about the process of applying into radiation oncology. And then we'll have a question and answer section about midway through the presentation. If you have any questions that you have or that come up during the course of the presentation, feel free to type it in the chat, and we'll try to get through as many of those as we can in the question and answer portion. This is a recorded session, so if you know of other people who were interested but couldn't attend, or wanted to refer back to this, this will be recorded and put online through the ACRO website. And before we begin, we just had a few poll questions, which Fraser was going to help us kind of set up. And then I'll turn it over to Cecile to introduce herself and our first presenter.
Yeah, so as long as technology is working, I've launched a poll, so you guys are able to answer those questions for you. At the conclusion of today's program, we're going to have some additional polling questions too. So we appreciate your feedback on these questions, and we do monitor this over years. So it's helpful to get this data from y'all. Cecile, it looks like 24 out of 24 have answered. Now we're 25 after 25, so I think we're good.
Great, thank you everyone for answering the poll questions. My name is Cecile, as Leslie said. I'm a PGY3 at UCLA, and I will be presenting our next speaker, which is Dr. Raldow. She is my amazing PD at UCLA, and so I'm happy to introduce her. So Dr. Raldow is an assistant professor in the Department of Radiation Oncology at the David Geffen School of Medicine at UCLA. She graduated from Princeton with a Bachelor's of Arts in Molecular Biology, and then she had a medical degree from Yale University. She then completed her intern year at Memorial Sloan Kettering and her residency at the Harvard Radiation Oncology program. While in residency, Dr. Raldow also obtained a Master's of Public Health degree from the Harvard T.H. Chan School of Public Health, and she specializes in GI as well as hematological malignancies. She has expertise in IMRT, magnetic resonance guided radiation therapy, SBRT, and other advanced techniques. And then her research focuses on therapeutic decision making, cost-effective care, quality of life, and health outcomes. So I am pleased to introduce Dr. Raldow. She will be discussing the ERAS application. Welcome.
Awesome. Thank you so much for having me and also for the introduction. I'm just going to share some slides. Let's see. And are you able to see them? I know this one's a blank slide, but.
Yes.
Okay, awesome. So I'm going to be discussing the ERAS application and I guess more specifically how we look at and kind of try to pick residents for interview with the ERAS application, since that is kind of the primary tool, the only tool we have for most people to invite to interview. So with respect to background, I just wanted to mention and be completely transparent on what we used to do when we got ERAS applications, which is a more kind of subjective review sense, or I should say in the past few years, we've been transitioning to a more holistic review process to make things more shared and to make things more equitable. But in the past, what we did was basically go through the ERAS application for each candidate and split into 3 different groupings. The program director, the associate program directors, and the chief residents would go through ERAS applications and try to assign candidates into one of 3 tiers: a high tier, which we definitely want to invite for interview, a middle tier, and then a lower tier. The lists were created independently, but again, they were really kind of just subjective. And there actually was a great overlap with the lists, particularly in the high tier, were people who we definitely wanted to invite for interview. But because we were probably all looking at the same things, but at the same time, it was quite unstructured. And then, you know, candidates who fell outside of that consensus would be discussed to see if they would be invited for interview or not. Now, in kind of the more recent recruitment cycle, we've tried to really improve on this process and try to create a more structured scoring algorithm to value and weight those areas where faculty and residents have agreed that are really essential in terms of skills, experiences, and other values that lead to a successful residency candidate. And those criteria and scoring points were broken into 2 main categories. So of course, there was objective data that came directly from set data points that we pulled directly from ERAS, like board scores. But then there was also great emphasis that was placed on other subjective criteria. And so this is at least what UCLA looks for in each ERAS applicant. We look at what medical school the applicants attended, the performance that applicant has had in clerkships, the strength of their MSP, and kind of, you know, where the candidate lies in comparison to their peers. If the MSP outlines that, some medical schools don't have rankings. We also notably place a large emphasis on the strength of the letters of recommendation that an applicant has, any leadership roles, community service, and volunteering activities. We also take into account the significance of life experiences. So if a particular candidate has really overcome adversity, that absolutely factors into our evaluation of the application. And then, of course, we look at research experiences and achievements, including publications and grants. And then we also take into account an applicant's background. So we want to make sure that we include people for interview who are underrepresented in medicine, of course. In terms of questions that I received prior to this particular webinar that I was asked to touch upon. The first was, what should we emphasize in the application? Well, I would probably go back to this list here and emphasize whatever kind of you have control over emphasizing. So obviously you went to medical school, wherever you went to medical school, you performed in clerkship the way you did. You don't write your own MSP letter, but I would make sure to emphasize your leadership roles, community service, volunteering activities. If you do have any significant life experiences, of course, you want to emphasize that. And then research, I think, is also pretty granular, but if there's a particular publication or a particular grant or experience that you've had, certainly emphasize that. The next question was, how should we choose writers for letters of recommendation? So typically, applicants will have at least 3, if not 4 letters of recommendation, if I'm not mistaken. The letters of recommendation, of course, you want to try to get someone who knows you well that can write a strong letter for you. I do recommend having radiation oncology letter writers, at least for a significant portion of those letters. Whenever we see a name, so the field of radiation oncology, of course, is quite small. And whenever we see a letter writer that we recognize, we usually also end up trusting that person just because we know that person. And then we feel also more comfortable kind of asking that person's opinion. And of course, a radiation oncology letter writer is able to kind of speak to the things that we as radiation oncology faculty and physicians look for. So I would, if you're able to, get radiation oncologists at least for some of those letters. And then in terms of what to write about in your personal statement, of course, that can vary. I will say that in reviewing radiation oncology applications, most of the personal statements do end up kind of blending into each other unless someone has had a really significant life experience. So if you've had some sort of experience that shaped you or shaped your desire to be in the field, certainly I would emphasize that. But I would try also not to stress too much about the personal statement. I know as a medical student myself, I really stressed out a lot about the personal statement, and then kind of looking at it from the program director's standpoint, I feel like the personal statements by like majority blend together. There are always, of course, a few that pop out. So I feel like a personal statement is more something that can really help you, but is less likely to harm your application. In terms of how many programs you should apply to, I don't have a great number or specifics. What I can tell you is that, of course, apply to programs that you would consider. I wouldn't limit yourself to just a few programs, just because you'll want to make sure that you're ranking enough programs to match. But if you know for sure that you're not going to be able to go to program X because that program X is in a specific location that you actually can't be in, of course, don't apply there. If you apply and you're getting a lot of interviews, I would recommend that you kind of decline interviews. I feel like the number of applicants that we interview ultimately as a program is how we form our rank list. So as long as you decline interviews, if you have too many, you're not taking a spot away from somebody else. And I feel like the kind of discernment as an applicant or from an applicant's perspective is probably honestly best done after you've gotten interview invitations. What should you do if you don't hear back from a program? Well, if you're really interested in that program and you haven't heard anything, I definitely would email to express your interest. Absolutely nothing wrong with emailing to express interest. It can help us as program directors to know that a particular candidate is interested. But make sure at the same time that you don't repeatedly email to express interest, because that I think can also kind of turn some programs off. But certainly one email expressing interest is welcome. Another question that I got was, do scores matter? And the answer is yes, they do matter. They're one of the components that we look at, but they're not the end all be all. We do look at candidates from a holistic perspective. So again, they can help you, but they're not the only thing by far that we look at. We really do take the whole application into consideration. And then finally, what should I write in the hobbies section? So I will say the hobby section is not something that we evaluate really when looking at who to invite for interview, but once a resident applicant has been invited for interview, I will always look at the hobby section prior to the interview day, just to see what hobbies a resident has, because it usually makes for really fun topics for discussion during the interview itself. And with that, I'll stop share and let you guys take it away. Thanks so much for having me again, and hopefully some of this information was useful to you.
Thank you. Thanks so much, Dr. Raldow. So our next speaker is my program director, Dr. Kiess. She's the assistant professor of radiation oncology and molecular radiation sciences at Johns Hopkins University, as well as our residency program director. She completed her radiation oncology training at Memorial Sloan Kettering and clinically is focused on the treatment of head and neck cancers, as well as targeted radiopharmaceutical therapies for prostate and other cancers. Her academic focus is the translation of novel imaging and radiopharmaceutical treatment techniques into the clinic. And Dr. Kiess is going to be talking about the interview process.
Thank you, Leslie, for the kind introduction, and thanks for inviting me. I want to second everything that Dr. Raldow said about our initial selection process and the application process. We are very similar at Hopkins on all those fronts, and our general advice to students. When it comes to interviews, I think my number one piece of advice would be that interviews are as much about recruitment as they are about selection from our standpoint. And so really, by the time you've been invited to interview, you can really relax and enjoy the interviews and get to know the interviewers. Because at that point, we're not really thinking about the numbers. So I want to encourage all of you, if you can, to be in a comfortable place and in a comfortable state of mind when you go through the interview process. I agree with Dr. Raldow's comments about declining interviews if you have a lot, and about number of interviews and such. So in the past several years, many of you will know that the interviews have been mostly have been all virtual because of COVID, and for the coming year that's continuing. We don't know yet for the future whether it will continue to be virtual. There's pros and cons of it. I think, a huge pro is that it's very cost effective and reduces bias among applicants because it's very expensive to fly or train or car, jet around the country to interviews. They're more time efficient. You get some increased participation from faculty because of the ability of interviewers to do interviews from their home office. So there's pros and cons. Obviously, the con is that you don't get to see the place in person or the people in person, so that connection of being in the same room is different. A lot of people say that it's more difficult to connect with the residents in the way that you would compared to an in-person interview where you would go out to dinner and have a drink the night before. And then if you've never been to the city or hospital where you're interviewing, obviously just the setting, seeing the setup of the department and the city and the potential places you could live, you can miss out on that. Although some of our students have come unofficially to the city just to, without coming to interview in our department, but just to visit the places that they are interested in potentially matching. And, you know, that's something that if you are able to do before your rank list goes in so that you can know the place is potentially helpful. So in this sort of virtual era, the way we have interviews set up is we have 20-minute interviews, one-to-one, and the applicants have sort of a schedule that's all with links for each interview, and then our faculty stay in the same Zoom room or virtual room, and there's a waiting room, and the students come in and out. There's different platforms that different programs use. So one of the things I would recommend is testing your internet connection and your platform ahead of time, if at all possible. So the biggest issues we've had in a few instances is with students having a major technical issue on the day of the interview. And we try to make it up by doing phone calls or having backup methods. We have backup Zoom links, backup phone call lists, phone lists for all the interviewers. But it does, you know, that's the last thing you want is for technical issues to get in the way of your interview. So if at all possible to be on a wired internet connection and to test the platform beforehand. A lot of times these are open Zoom links, so you can just open it up randomly and see that it works on your computer, you know, the morning of or the day before. Many of the programs have a sort of social event virtually with the residents. We have ours usually the night before. And I would recommend making every effort to participate in that, even if you're not able to make it for the whole time, that you take the opportunity to get to know the residents. And, you know, we take resident input seriously when it comes time for ranking. And I think it's nice when the residents get a chance to get to know the applicants. Obviously, if the applicants don't make it to the resident event and there's just not input, it doesn't, you know, influence us positively or negatively, really. But it's something I would definitely advise, because the residents will give you a real sense of what it's like to be in the program and in the resident room, and they'll be your peers and colleagues that are closest to you during your training. Sometimes there's breaks during interviews where you can also kind of enter a break room to join the residents, or virtual tours, but as much time as you can get with the residents through the virtual interview platform, I would take it up. I wanted to comment a little bit about sort of interview styles. So, you know, a lot of the programs have had training on bias reduction. And our program, over 20 of our faculty have had the formal bias training for the interview process to try to reduce bias. And we have a lot more faculty using behavior-based questions for the interviews rather than standardized questions. So I just wanted to give you some examples of what behavior-based questions are. So they're trying to get more at your self-insight and your own initiative and ability to handle stress in your own personality. So some questions that I've asked in the past are, you know, who was your greatest mentor and why do you think they were such an effective mentor? So it's like often a second question that has to do with kind of filling out not just the simple question, but a deeper insight to it. Another question we've used in the past is, you know, if you weren't going to be a doctor, what other career would you be interested in and why? Or tell me about a time when you were on clinical rotations that you encountered a difficult patient situation, and explain how you or your team handled that. So these are behavior-based questions, and you'll have a lot more of those in interviews, hopefully these days, because they have less bias. So you can, you know, prepare a little bit by looking up what some of those questions might be. Another huge thing is showing the programs that you're interested in the interview process. Like, it's always nice to hear, through the virtual environment that I really am interested for these reasons. And I agree with Dr. Raldow, sending an email to the programs you're most interested in. One email is totally acceptable and a positive thing. We can tell when someone emails all programs. It's just like when you're a program director and you get an email that you think has been sent, like copied and pasted, just your name in this line, we can kind of tell that it's a standard email, but like a personal email about why you're interested in a certain program is nice. I would not say you do not want to tell them where you're ranking. It's really not something that we're supposed to do after the interview process is over. And there's always been a lot of discussion about this. There was an agreement among a lot of programs about 5 years ago that we wouldn't initiate asking or, expecting to have contact around what rank order people are putting us in or vice versa. And it's against the spirit of the match. So do not feel like you need to tell your top program that they're your number one. And a couple other notes. Most programs have a meeting right after the interview day where they do an initial ranking, or not ranking, but scoring before you, when everybody is fresh in your mind and you can picture everyone's face and you don't forget the details. So that often happens either the same day or the next day, just for full disclosure of the process. And then there's separate meetings after all the interviews days are done to go through the final ranking process. And I think that's all of my prepared comments. So I look forward to the Q&A at the end.
Thank you, Dr. Kiess. The next speaker is Dr. Rosenberg, and he will be talking about the match and ranking process. Dr. Rosenberg is an assistant member in the section of thoracic oncology and assistant program director of Moffitt Cancer Center Department of Radiation Oncology. He earned a Master's of Science in Clinical and Translational Research at Rutgers University in combination with his medical degree. He also completed his residency in radiation oncology at the University of Wisconsin. His clinical focus includes treatment of patients with thoracic malignancies, and he's interested in combining radiation with immunomodulatory drugs and targeted therapies to improve outcomes. He also pursues research with a special focus on MRI-guided radiation. He is interested in using radiomics as well as genomics as part of his research efforts, and he is part of FORT, which is Future of Radiation Therapy Departmental Research Program, which aims at personalizing radiation therapy using novel approaches to improve local control of tumors and decrease side effects for patients. Thank you for coming.
Thank you so much for that introduction. And I just feel very fortunate to be here with Dr. Rao, Dr. Kiess. Thank you so much for all the comments. And I just want to reiterate that I agree with almost everything that's been said. Hopefully I can be a strong closing act for some of these things that go through as you're going through this process for today. I really wanted to talk about, the rank list and how you think about this, and hopefully provide some comments that are practical and useful and give you some general aspects about the whole ranking process. I think one of the things I really wanted to emphasize to potential applicants is that it's a long interview process, meeting with different programs. And as months go on, really can sort of forget what your interactions were like at program X versus program Y. And I really encourage our medical students who come through from our medical school who are going into radiation oncology, and rotating students who are heading into radiation oncology, is make sure as you meet with programs, keep a running notebook or a running journal of what your experience was like that day. Because it's so hard to look back 2-3 months as you're putting together your rank list and sort of say, what was that really like? What was my day like? And programs start to blend together a little bit. Did I have a good feeling from the residents or not a good feeling from the residents, a good feeling from faculty? And write down, oh my goodness, write down, I can get a power surge here in Tampa. So hopefully I'm still here, but write down, your feelings about, the program, how you felt about the interview day. And so when you're putting together your rank list, as you get through this process, you can go back and look at your notes and remind yourself about what you felt and different things that stood out to you in a positive or negative way, because it's hard to remember all those things. I think the other big thing about the rank list process is that, it's an evolving process as you feed back to your mentors, to yourself about where you want to put programs as part of that. And one of my biggest pieces of advice as you think about this is that do not change your rank list the night before, right before you're going to submit something. At the end of the day, I have seen resident applicants do that. They make a last minute, change of heart, and all of a sudden it's like 5 minutes before midnight or the deadline, and then they're going to change something. And so, think through this, spend the time, but really resist that urge as you sort of head through this to make those sort of last minute changes. And I think having those notes to refer to can make a big difference with that as well. I think once you get to the interview portion, though, at least what we're looking for at Moffitt, and as we think about the interview process and the ranking process, is that we know you're going to be a good radiation oncologist. If we've invited you out, we think that you are going to be a good radiation oncologist. It's more making sure that you're the right fit for us and we're the right fit for you, because we want to make sure that you're going to fit within the culture we've created and you're going to be successful. And that's part of what we're thinking about when it comes to that. And so when you're finding that fit, it's really more about how you interact with everybody. And so really we take a very holistic view to ranking. Once you've made it to the interview, when we are doing the ranking meeting, that takes place soon after, most often that same day after you've done the interview process. And we are, everybody is contributing to where you sort of fell on the rank of the day. About, we give everybody a score in terms of their interviews, and that's really focused on the interview process. And when we do that, we sort of create a running rank list a little bit about how we're going to be sort of orienting people. And then we're meeting after each interview day, and then we meet still in between that to see if this list needs to be sort of tweaked, because we're trying to make sure that we're giving people feedback from right when we've met them at that period of time. And so we're taking notes down for ourselves. And again, as part of the ranking process, everybody gets a say. People that you interview with, which includes, faculty, which includes for us our physics faculty. Sometimes we'll include some dosimetrists in there, or therapists in there as well. We do think a holistic view there is really important when it comes to the review of applicants, again, and making sure they're the right fit. And that includes the residents. So the residents have a very important say as part of our rank list process. And I do think that is the one downside to virtual interviews, is getting to, I think, spend more time with the residents. We do have virtual events we've been trying to do at Moffitt. We've done some, mixers and other things, the night before, or even virtual dinners with DoorDash and things of that nature. But, still, that's the one side, the downside that I feel like you don't get as much with the virtual interview process. But we do really take into account everybody's perspective on this. But just know, once you've gotten the interview, we think you're going to be a great radiation oncologist, and it's really more about the fit with our program than it is anything else when it comes to that. I want to reiterate something that Dr. Kiess mentioned about communication afterwards, after the interview process. We do have people, we are not encouraging people, and we do not, I think all of us who are, helping to build residency programs or are in charge of residency programs, we're not looking to have you communicate, we're your number one or any of these things. In fact, we're discouraging people to do that. And if you do send that email, just know, because I don't want people's feelings to be hurt, is that we will not respond. And that's really just, again, to try and keep things fair and balanced when it comes to that. And so I know some people, wonder like, well, I sent this email letting program X know I'm, their number one choice and I never heard back. Our philosophy at Moffitt is, because we're trying to, take out as much bias as we can with this process. If you send us that email, we will not usually respond to it, just letting us know that you ranked us as your, say, number one pick when it comes to that. So please do not take offense to that. That's us just trying to be as fair as possible as we go through this entire process for everybody. I think other things we think about with programs that are red flags, you're doing the interviews and you're thinking and you're reflecting back in that journal about how you're going to rank programs. I think that programs that limit your interaction with the residents is a big one, because if a program is not letting you talk to the residents, or not letting you spend enough time with the residents to get to know them, I think that's a red flag. So as you're thinking about your rank list and you made notes to yourself, if you got minimal time with the residents, that would be something that I would be questioning in my head as part of the program. I do think that I'm involved with, and I know a lot of the other program directors here are at major centers that have lots of technology. I think I wouldn't, even though I do a lot of research with MRI guided radiation treatment, and I'm very biased about that, I would not be ranking a program based on what tech they necessarily have. Tech comes and it goes. There are pros and cons to protons or MRI guided or whatever it may be. I would really be focusing on the culture of the institution, the culture of the program, and how you fit into that, and how you sort of fit into talking to the faculty and the residents after all of that. I mean, you can think of some technology components, but it wouldn't be a driving force when it comes to that notion. In terms of your rank list, and thinking about some people think maybe they grew up in they're in medical school in the Northeast, but they really want to come back to Florida at the end of the day. How do you sort of make that known as part of the rank listing process? You can definitely customize your personal statement, which helps us let us know that. I know that we're sort of late now into away rotations, but it's the other way you sort of let people know about your interest in other regions. That was one of the other questions that was brought up to me as part of this, but obviously it's a little name for away rotations for some people, but your personal statement can be personalized a little bit by different programs. So it'd be good to know that, hey, I have ties to region X. And we do think about that in terms of region a little bit for people, because we just find that people are happier if they're closer to family or they have a strong reason to be in a certain location. That is something we think about, because our goal as we're ranking all of you, again, if we're interviewing you, we think you're going to be a great radiation oncologist, place you're going to thrive. And in our view at Moffitt, it's whether it's at Moffitt or it's at Johns Hopkins or UCLA, these are all great programs. And so our goal is really your happiness and success through the entire thing. And that's really, as we think about the rank process, that's how we very much think about it. And as I said, the only other real big feedback about the ranking is if there's a program that you interviewed at and you absolutely cannot see yourself there, do not rank the program. And I know that can be hard. People say, well, I did the interview, I went through the entire thing. But if when it's on the rank list, there's always a chance that's where you end up matching. If you could just say to yourself or your significant other or your family is that I'd rather go unmatched than match at this place, then do not rank that program. And that's my other feedback there. I'm sure that that's gonna be very, very few programs. I think everybody in radiation oncology there's a lot of amazing residency programs out there, but if you ever feel that way, definitely do not rank that program. And the last thing is I will reiterate is don't change things the night before, 5 minutes before the rank list is due. So with that, that's at least all I had, because our other two amazing program directors hit on a lot of the other things I was going to say, and I would just reiterate that they did a fantastic job. And it looks like a lot of us are in sync about how we think about the process.
All right, thanks so much, Dr. Rosenberg. So now I think it's time to kind of start the Q&A process. So Fraser, if you can pull up that PowerPoint, and if any of you participants have any questions, please feel free to send it in the chat, and we'll bring it up as well. These are just some other common questions that we've had or had in the past, some of which have already been answered by our wonderful speakers. But in case there's some of these questions applicable to some of our applicants today, we definitely want to get some more insight from these program directors. And we'll just kind of discuss it as a group. So the first question, I think, Dr. Rosenberg had touched on this, but, if I want to train in a region where I don't have ties, how can I stand out to programs within my region of interest? So I don't know if some of the other PDs want to just chime in or say if there's anything else that they can do to really get that interview process going.
I would say you can just directly say that and say it in more than one interview. I've had a lot of residents or students say, you know, I'm from the West Coast, but I want to move to the East Coast because of this reason, or I'm interested in, you know, branching out from California or Texas or Florida, you know, the farther away places. But yeah, if you want to train in specifically in a certain region, just tell the programs in that region when you interview, and tell more than one person, I would say.
Agree. And then Dr. Rosenberg already mentioned you can use a personal statement to also explain that if you want to get that message across before interview selections are made. Or send an email. One. That can also be part of it. So many different ways.
And then I think there was a question prior to this slide. Great. And so the next question is, can a student who's failed a USMLE STEP exam still apply to radiation oncology? And one of the follow-up questions from our audience is just addressing also step 1 as now being pass fail in relation to how you rate candidates.
So I'll at least say that very much so. I think someone with a failure on one of the STEP exams can apply for radiation oncology. I'm very much a believer that anyone can have a bad day. Somebody gets sick, something happens. What I want to usually see in that scenario, at least when we're reviewing applicants, again, I think we're trying to, just like Dr. Raldow mentioned, is trying to take a very holistic look at the applicant. Is this an outlier? They've done very well in clerkships. You know, they have a really strong step 2 CK. And so, you know, I think more of a red flag is if you had multiple rounds of failure on step 1, that would be a much bigger red flag to me. But I am a big believer that anyone can have a bad day, life things happen, someone gets sick, you know, something happens. And so we try to take a look at that in the context of the application as a whole.
Agree. And oh, sorry. Go ahead.
You first.
Oh, no, I was just going to say, I agree with that also. And if there's something that you yourself want to address within your application where you know, you failed step 1, you can use your personal statement also just to kind of help provide context.
Yeah, I agree with what everyone has said. I think, you know, the step going to pass fail is to try to reduce bias coming from over-reliance on the step scores. Our program, at least for the past, ever since I've been involved in our program, like at least 5 or 6 years, we haven't had any like cutoff scores for any exams, and we screen every applicant like thoroughly, looking at the MSPE and the letters of recommendation, everything like Dr. Raldow mentioned. So there, I think in the past was a lot of programs, especially the programs with larger residencies like internal medicine or general surgery, where they would just have a cutoff because they couldn't handle the volume of applicants. So they would just use the USMLE step 1 in that manner, which introduces a lot of biases. So, you know, I think every program is going to use the information they have. So with it going to pass fail, until it's pass fail, we will use the scores that we have. You know, it's all going to just come in through the ERAS system into our spreadsheets. So I think the programs will still continue to incorporate it as one data point when it's a full digit number versus and when it's pass fail. But I agree that you can definitely still apply with a failure.
Okay, and Fraser, can we go to that next slide? So this is also one of the questions in the chat, but how is the application and interview process different for international medical school graduates, or do they need any research opportunities for international medical graduates?
I mean, at least at our program, I don't find that our holistic review of the application changes. There are some visa limitations that oftentimes I'm always trying to make sure that I'm working through with our GME office. But in terms of the holistic view of the application about how they did in school, their letters, their interest in radiation oncology, other aspects of things they've overcome. I don't think it changes for us much at all. I think the one challenge for international medical graduates can be some of the visa obstacles. And, we're always working with our GME office to see how we can overcome them for different things. But I know it's like a whole field within itself, understanding all the visa aspects at the end of the day.
Thanks. And next question. So this one was kind of already touched upon. Any additional preparation that that PDs would recommend in terms of preparing for the interview day?
So usually we have 8 to 9 faculty interviewers and a chief resident, and then more open meetings with the residents. And then we try to give the interview schedule at least a week or 2 ahead of time so that you have time to look up who you're speaking with and what their specialty is. You don't need to know their CV, but just the basic gist of, what campus are they on, what's their specialty, and, sometimes people know what their research interest might be. Or even sometimes they know where I trained and say, well, how would you compare where you trained to your program that you're leading? So, they'll ask good questions like that. But you don't have to prepare in depth. I would say, 30 minutes to an hour per interview. Don't make yourself stay up late and get tired preparing for each individual interview.
And I think to piggyback off of that, some other questions in the chat were, do they need to answer any radiation specific, technical questions during the interview? And, if they don't hear from a program, when would be a good time to reach out to them? I'm guessing that's before the interview.
Yeah, so I can talk about kind of technical questions, at least at UCLA, and I didn't come across any when I interviewed for residency, which I do recognize was probably a decade ago, but we do not ask any technical questions. You guys are medical students, you have a whole residency in front of you. If you knew everything related to radiation oncology already, you wouldn't need a residency. So absolutely no technical questions. We do ask sometimes about some of the research that you've done, helping us explain the research that you've done, but those are all things that you should be familiar with because those are things that you yourself have kind of worked on in detail. And then in terms of reaching out, I think probably a good time to reach out is, well, I can tell you for UCLA, we usually send our interviews out probably right after ASTRO. So before then would be great, but anytime, honestly, is okay.
Yeah, there's often a wait list at certain programs for those, we have 45 interview slots, but we have another 5 or 10 people that we now officially have a wait list. But before it was even an unofficial wait list, just the next group of people on our list. And then as people cancel, we fill in those slots with people from the wait list. So, if you haven't heard from a program, by mid-November, maybe, and you're interested for a particular reason, it may help you with getting on that wait list. And we'll have people cancel even 2 or 3 days beforehand an interview, and then we'll fill that slot with someone from the wait list who sometimes matches. So it's, take your opportunities to be added to a wait list and ask for that if you haven't heard from a program.
Absolutely. Once kind of you're at the interview, we are considering you. So even if you get in off the wait list, do not feel deterred because we absolutely, take you into consideration.
Yeah, I'll reiterate two things. One is that I actually did get asked technical questions during when I interviewed for residency, and that was not fun. We do not do that at Moffitt. So I don't think it's very common. So I don't want people to worry about that. But I do remember as an applicant, somebody asked me, some technical questions, and I was definitely not prepared for that. So hopefully, I don't think it's still very common. So I would not worry about that too much during the interview season. And as was already mentioned, I think once you're at the interview, whether you were off a wait list or not, I think then it's almost like a blank slate for us as we're sort of thinking about the rank list process. So whether you were sort of a last minute invite because you expressed interest and then came in there, we view you that same way as anybody else who was interviewing that day. So as was mentioned, keep that in mind. And I agree. We've had some people come in more last minute for somebody else who canceled, and they're the person we matched. So I think that's not an uncommon scenario.
There are some questions that the interviewers aren't supposed to ask you. So, we remind our interviewers of this, but they're not supposed to ask you where else you're applying to, if you're applying in other specialties, if you're married, if you have kids, trying to think of other no-nos. But, you can defer or redirect the conversation if they ask you these kinds of questions. If it's, you can report it to, your program director of your home institution, and, they can kind of anonymously, there's things, but those are things that you're not going to be or shouldn't be asked.
Yeah.
Thank you. And then one more question, just to be mindful of time. So let's skip a little bit forward. I think the other question being, I think this one would be a good one. So what to look for in an radiation oncology residency program, and what are some red flags?
I think I briefly touched upon this, but I'll just reiterate for me is that, again, red flags are things that you do not get to interact with the residents or talk to them or spend time with them. I think that's a red flag. If faculty just seem disengaged during the interview process, I think we have almost 30 faculty in our department, and there are people who are asking to interview. And so if, we turn people down in terms of who's interviewing as part of the process. And we try to take not just MD faculty, but a holistic view. And so if people seem disinterested in the process, I think that's another red flag across the board. And I think, again, I would emphasize, I think trying to get a feel of the culture and, how people interact with your attendings and what the learning style of the program is are things I'd be looking for. And I think tech is one thing to at least consider, but it's not everything. And just make sure people seem happy and enjoying the experience. And residency is not easy. So you want it to be a supportive environment and culture that you're a part of through all of this.
And then a few more questions. If people have not taken step 2, is that okay prior to the application process? Can you still be competitive if you're in your second or third quartile in your MSPE? Any comments on those?
We have many people we interview who haven't taken step 2 and or are in the second or third quartile of their medical school class. So again, these are just individual data points. The step 2 particularly, now that step 1's going fast fail, I don't think step 2 is going to be, it might be more heavily weighted in the future if it stays a number. I don't have a strong opinion about step 2, but we look at the MSPE and the quartile, but we put it in context of many other things.
And then another question was just where did you apply? So I think you apply through the MSL and USMLE. So that's something that you can Google to work through and to complete the application process. So again, we just want to thank all of our speakers for coming. We really appreciate you taking time out of your busy days to really interact with some potential applicants answer questions, give your own kind of personal experience and expertise in the subject. And for the viewers, we just have a couple ending poll questions that we would really appreciate if you would answer, and then if Cecile would send us off.
Yeah, and so while everyone is filling out the poll questions, I do want to give a plug for the ACRO mentorship program. You do have to be a member, but yeah, once you're a member, it's really cool. You get paired up with a resident. And so if you have any more last minute questions, you want to talk to a resident anywhere within the country, you can request areas. So yeah, you can find us on the ACRO website and sign up for mentorship.
Okay, great. So we'll just leave this poll on just for a few more minutes while people answer the questions. But again, thank you all so much for attending. And if you know of people who want to get a recording of this, it'll be up on the ACRO website in a few days.
Thank you so much for having us.
Thank you for joining. Bye, everyone.
Thank you. Bye.